Music.
Pause music. Alright, welcome guys to the nursing channel once again. My name is Sam, and I know I have been gone for a while, but I am back, and that's what's most important. I think the last time I uploaded a video was a few months ago. But anyways, I'm back, and I'm ready to kick butt and provide you guys with information and nursing knowledge. Okay, so the question is, what is a discharge assessment? So as a nurse case manager or a nurse discharge planner, the primary tool that you're gonna use to get through your job, to get through your shift, is you're gonna use what's called a discharge assessment or a face sheet. So a face sheet, you can print it out from the patient's electronic medical record. And what a face sheet has is it has all the patient's demographic information. So like what their phone number is, where they live, what are their emergency contacts, and what kind of insurance do they have, who their primary care physician is or primary care doctor is. So it'll have all of that patient's basic information. So your job as a discharge planner or nurse case manager is to make sure that all that information is still true and it's current. So what you're gonna do is you're gonna go to the patient's room and introduce yourself. And you would do it something like this. Hello, Mrs. John. Hi, my name is Sam. I'm a nurse case manager, and I just wanted to make sure that we have your correct information on file. And then she'll say hello, and she'll introduce herself, and then you say, hi, Mrs. John Doe. Can you just verify your name and date of birth for me, please? Okay, and then she'll give you her full name and her date of birth. Okay, Mrs. John Doe, I'm just gonna look at your wristband, make sure that the information matches. All right, very good. So just want to make sure that we start off by verifying your home address. Is it still blah, blah, blah? And then she'll say yes or no. And then she'll give you the current address, or basically repeat whatever address is on the face sheet. And then you can say that, hey, it matches. And then you ask the patient, what's a good phone number to contact you at? And the patient will give you their phone number. Why do you want to verify the patient's home address? Because let's say the patient came into the hospital. Let's say they just got newly diagnosed with chronic obstructive pulmonary disease, and the patient's going to need an oxygen, a piece of oxygen equipment delivered to them. You want to make sure that the oxygen equipment is going to be delivered to the correct address, because once you give the address to the vendor, they might deliver it to the wrong address, and then the patient's going to get home and they need oxygen, and so they might not get the oxygen delivered to their home. So that's why you want to make sure that you have the correct address for the patient on file. So you verify that information. Why do you want to make sure you have a current phone number for the patient? Because you're going to give that number to the vendor that's going to deliver the oxygenator or oxygen medical equipment to the patient. Because the vendor is going to contact the patient and say, hey, we're at your front door, can you please come out, we have your oxygen medical equipment. Or they're going to say, hey, they're going to call the patient and say, hey, what's a good date for us to deliver the machine? Okay, so that's why you want to verify that information. All right, the next step you want to ask the patient is who their primary care doctor is. Once you ask that question, then you want to ask the patient what kind of living situation they live in. So one of the questions you would ask is, hi, Mrs. John Doe, do you live in a single level home or do you live in a multi-level home? And then she'll say single level home. Okay, why do you want to ask this question? Because if the patient lives on a 2-story home and the bathroom's on the 2nd floor, and if, let's say, the patient just had a recent knee surgery or hip surgery and they can barely walk, they can barely ambulate, if they get home and the bathroom's on the 2nd floor, and there's 12 steps to get to the second floor, you got to think about, how is the patient going to go upstairs? They can barely walk. Do they have any help at home? They're not going to just, you know, poop on in their pants. They need to get to the restroom. So you got to anticipate and ask these questions so you can plan ahead. The next question you want to ask is, how many steps do they need to climb to get into their home? Okay? Kind of bit my lip. Ouch, that hurt. How many steps do they need to climb to get into their home? Let's say the patient has 15 steps to climb to get into their home. And like I said, the patient just had a recent knee surgery. They get home, and how are they going to get into their home? Do they have a family member that's available to assist, a friend? So you got to think about this stuff. Okay, once you ask those questions, then you want to ask them, who do you live with? That way you know what kind of support system the patient has at home. Do they live with their husband? Do they live with their children? Do they live with a friend or roommate? You want to ask that question so you know what kind of support system they have. Okay, and then you want to ask the patient, what is your baseline level of mobility? Are you independent at home? Can you go from the bed to the toilet on your own, to the bathroom? Can you cook your own food? Do you clean around the house on your own? Do you drive? Why is it important to know this? Because let's say the patient, like I said, just had a recent knee surgery, and they're slowly recovering. They get back home. We want to know if they can do these things on their own. If they normally don't do these things on their own, you want to make sure that the person who helps out is going to be at home to help cook for the patient, to help clean the patient's home. That way, you know, the patient doesn't get back home and they're starving to death and they can barely get out of bed. And, you know, if they have a person that assists at home, we want to make sure that that person's going to be present at home to help the patient with toileting, with feeding them. Okay? Next question you want to ask is, what kind of medical equipment does the patient have at home? Okay, the patient, you want to ask them, do you have a walker, wheelchair? Do you have a oxygen machine at home? Do you have a CPAP machine at home? Why do you want to know this information? Because if you need to order equipment for the patient, you already know what the patient has at home. That way you don't order things twice. Okay, and then you want to know what the patient's preferred pharmacy that they use. That way you know to tell the doctor, hey, can you please send the patient's prescriptions electronically to this pharmacy? Okay, that way the patient can pick up the medications at the pharmacy that they prefer to use. Okay, and then we're getting close to the end. Then the next question you want to ask is, so Miss and so, once you get better and you're ready to go back home, who's going to be able to drive you home? You want to ask them that question. That way you know what kind of if they have transportation once they discharge, or if you're going to need to arrange transportation for them. Maybe you can use a taxi. If they can't use a taxi and they're bedbound, you're probably going to have to order an ambulance. Okay, so you always want to ask these questions so you can anticipate on what you need to work on and what you don't have to work on. Okay, and then last few questions are, you want to verify the patient's emergency contacts, make sure that they're still current. And then last question I usually ask is just verify their insurance information, and then that's it. Then once you finish asking those questions and you verify that information, you go back to your workstation, you chart this information, and then you look at the things you need to work on, and you look at the things that you don't have to do nothing on. If they're independent, then you know that once they get home, they're not going to need a caregiver or any assistance at home. So I like it when patients say they're independent because it makes my job easy. I just check that on the box and we're good to go. So guys, that's basically what a discharge assessment is. And you'll be doing this a lot as a nurse case manager or nurse discharge planner. I hope this video helped you guys. For all you nurses who are looking to get out of doing direct patient care, you guys are tired of smelling C. diff, tired of doing wound care, you guys are burnt out from turning patients, from lifting them up from the gurney to the bed, lifting them up to get from the bed to the commode. If you guys are tired of that and you guys are looking for another alternative in the nursing realm, and you guys are interested in going into nurse case management or becoming a nurse discharge planner, then I hope this information helps you guys so you guys know what you guys are getting into. I personally love my job. I get to my job clean and I get to leave my job clean. And I get to dress like this, except without the sweats. I'm at home, so I'm just getting comfortable. I just did this for the sake of the video. But I hope this video helped you guys, and it'll help you guys make a decision whether you guys want to get into nursing case management. I hope you guys like this video. Subscribe if you like it, and if you don't like this video, get off my channel. I'm just kidding. Hope you guys have a great day, and I'll try to upload more content. That way you guys become more familiar with what we do as nurse case manager and discharge planners. All right, take care, guys.